This is the injury report presented by NYU Langone Health. Giants running back Tyrone Tracy Jr. is expected to be sidelined 2 to 4 weeks with a dislocated shoulder that he suffered in Sunday night's loss to the Chiefs. So, in today's injury report, we're checking in with NYU Langone Orthopedic Surgeon Dr. Guillem Gonzalez-Lomas on when Tracy could be back in the lineup because the Giants have to get their running game going ASAP. Doc, the Giants have to get their run game going ASAP. Cam Scatterboo now next man up mentality for the Giants. With Tyrone Tracy being out for 2 to 4 weeks. So for dislocated shoulders, what's the healing and or the rehab process like?
Yeah, Brandon, I mean, really bad luck here for the Giants, and it's kind of continuing a theme for the season. But, really important to understand that, because sometimes these terms get thrown around, really important to understand what exactly is injured. So when we talk about dislocated shoulders, we're talking about the ball coming out of the socket. A lot of times we describe it like a golf ball on a tee, so it's the ball falling off of the tee. There's another term, separated shoulder. That's a completely different joint. That's at the end of the collarbone and on top of the shoulder. But presumably what we have here is a dislocated shoulder. And when that happens, there are injuries to the soft tissues in the shoulder. So there's a little O-ring, almost like a gasket around the socket. That's called the labrum. And that gets torn pretty much every time the ball comes out of the socket. That's also in the area where ligaments attach. So both of those things need to heal somewhat for that shoulder to be stable and allow Tyrone Tracy to get back to play.
So let's talk limitations, because this is a former wide receiver turned running back. Run the football in between the tackles, can catch the ball out of the backfield. So when he returns, is he going to be limited at all with the use of his shoulder?
So the worst position to be in with a shoulder dislocation is going to be with the arm kind of outside the body, so up and elevated. A lot of work for a running back is going to occur with the ball next to the body, and that's relatively a safe position for the shoulder. But as you know, it's a collision game, it's a contact game. If you look at the video, I mean, he sort of got sandwiched by a few guys. So, of course, there's a chance that this could be re-injured, and he may have some mobility issues. I think the training staff is going to look to make sure he can protect his shoulder, that the muscles around the shoulder are strong, and that they're protecting it. But they may be okay with him coming back with a little bit of stiffness. It's just that means he may not have a lot of that overhead mobility that he might otherwise have. So there will be some limitations, most likely, to the extremes of motion that his shoulder can do.
So you just kind of answered my question with is there an increase with the risk of him dislocating the shoulder again when he gets back? So what's that going to be like for the player, knowing that, all right, I'm healed, I'm fine, I'm clear, but at the same time, I could easily suffer the same injury and re-dislocate it again?
Yeah, that's a great question. And, I think the medical staff is going to be honest with them. Obviously, returning to play, the answer is unequivocally yes. If he returns to play, there's a higher risk that this shoulder can come out than before he ever had a dislocation. But what we do is we temper that risk, titrate the training, make sure that he can protect the shoulder and limit it as much as possible. On the mental side of things, that's where the medical staff and other professionals in the team, if they have a team psychologist, that's where they come into play and really talk to him, make sure he's confident in practice. That can do a lot to give a player confidence that they can get back to playing. And, as he progresses, as we've talked about before, every case is a little bit different. So there's a timeline, but it's always about the player. It's always about how confident they are, how the shoulder is responding to physical therapy and to the rehab he's doing. Once he's there, at this level, at the pro level, I think these players, they go for it. And that's obviously the goal here, to speed up that process, but, really make it as safe as possible when he returns, still understanding that the risk will be higher that the shoulder could recur again, that the dislocation could recur.
So because of that risk, let's say the Giants are 0-3 right now. Let's say Jackson Dart can't come in and provide some sort of spark. let's say they're mathematically out of the playoffs by end of October, early November, do you then shut him down for the season knowing he could re-injure that shoulder as well?
Again, every one of these cases is very unique, and there's a lot of different permutations. So, first of all, is there a history of a dislocation in the shoulder? Maybe something in high school or in college. The other thing you look at is baseline laxity. If he's got very stretchy ligaments, that might influence. And then, very importantly, is there any bony involvement? So sometimes in these injuries, there might be a little chip off the rim of the socket. There might be a divot in the ball part on the humerus. Those will contribute to the risk, more or less of this shoulder redislocating. So you put that all together, and we actually have some very nice equations that can give us a sense of how risky it is for this shoulder to sustain more collisions. And you put all of that together, and then you make a decision. And in some cases, players can play again and they don't dislocate. But in a lot of cases, they may need surgery down the line. So again, I think it's very premature at this point. We don't really have a lot of details about what's affected anatomically. But what we can say is it sounds like the medical staff is confident that they can get him back, in a few weeks. And then time will tell. If he has another injury, that may affect the decision to operate or not operate. Or if, he doesn't necessarily have a formal dislocation, but he doesn't feel confident with the shoulder, ultimately that may dictate what happens down the line.
Well, you all have a great medical staff at NYU Langone. So let's say a patient came in with a dislocated shoulder. What would be the prognosis and recovery for a regular person who suffered the same shoulder injury?
Yeah, and again, we put everything in that little bin and we come out with, a plan, a patient-specific plan. So all the things we talked about, age, the bony involvement, the ligamentous laxity, history of dislocations. There are other measurements that we do. Some angles in the shoulder can predict a redislocation risk or not. So we put all that together. A good example is an older patient may be able to get away with just physical therapy, but someone who's younger and who will participate in collision sports, maybe they're a high school, college athlete, they're going to, have that higher risk of redislocation. And so that might be someone that you're a little bit more aggressive with talking about surgery. But certainly initially, it's very reasonable to try physical therapy, try to strengthen the shoulder, see how it feels. Then there are certain positions we can put the shoulder in. And if a patient is very apprehensive in those positions, it tells us, hey, this is kind of an unstable shoulder. We probably need to fix this. But if they're very comfortable in those positions, then a lot of times we can treat these patients non-operatively. So again, it's a patient-specific algorithm, and it really depends on the specifics.
That's why you guys are the best. You ready for Darty Day on Sunday? You ready for the official start of Jackson Dart era?
Absolutely. Listen, I'm excited, and you and I have talked about, again, next man up, and sometimes that next man up is, a perennial Pro Bowler. So you just never know who you're going to get. And I think, look, as a New Yorker, you just want to look on the bright side here.
There we go. Thanks, Doc, for hanging out with us.
Thanks as always.